Director of Environment and Health for the PSR National Office. Today we'll be presenting an introduction to COBRA, the Co-Benefits Risk Assessment Program developed by the EPA. Our objective for you is for you to get a sense of how you can use COBRA to assess the potential health benefits of the Clean Power Plan and of other clean air programs that your community might implement. We'll get started in just a minute. I think we'll have a few more people joining us. In the meantime, just a few housekeeping details. The presentation will last about half an hour. We've reserved a good chunk of time at the end for questions and answers. If you do have questions, please type them into the question box on the right-hand side of your screen. As audience members, you'll be muted during the presentation, but when the presentation is over, I'll call on you and you'll be unmuted to state your question. This webinar will be recorded and we'll post a link to it on the PSR website. I'll also send that link out to everybody who's on the call and actually to all registrants. By the way, we have Julia Morgan, PSR's web manager, at the controls during the webinar. Thank you, Julia. I'd like to introduce our guest speaker today. Could we have the next slide, please? We're very fortunate to have Skip Laitner serving as our speaker today. Skip's a resource economist with a deep background on benefit cost assessments, resource costs and constraints, and the net employment and macroeconomic impacts of energy and climate policy scenarios. Skip currently leads a team of consultants based in Tucson, Arizona. He's also the president of the Association of Environmental Studies and Sciences, AESS, an independent interdisciplinary and professional association in higher education. PSR is pleased to be a sponsor of AESS's 2016 conference coming up this June, and we hope we'll see some of you there. Skip's also the author of more than 320 reports, journal articles, and book chapters. He worked previously with the American Council for an Energy Efficient Economy as Director of Economic and Social Analysis, and before that served 10 years as a senior economist for technology policy with the U.S. Environmental Protection Agency, EPA. In 1998, he was awarded EPA's Gold Medal for his work with a team of economists to evaluate the economic impact of strategies that might assist in the implementation of smart climate policies. Skip came to our attention thanks to his collaboration on climate and energy issues with Barbara Warren, Director of PSR Arizona. Barbara shared with him our handout on energy efficiency and health that we put together with the American Council for an Energy Efficient Economy, and ACEEE put Skip in touch with me. So thanks to both of them for closing that loop for us. The COBRA program that Skip is going to tell us about is a powerful tool for identifying the health benefits of cleaning up the air. Like most powerful tools, it's complex. So today's presentation is really more of an introduction than a full-blown training course. However, Skip will also suggest to you where you might look in your community if you need help in applying the COBRA program, and we'll tell you about the assistance available on the EPA website. So without further ado, let me give you Skip Laitner. Skip?
Yes, thank you, Barb, and good afternoon, good morning all, depending where in the country you might be. Delighted to be here and really once again having the opportunity to collaborate with our colleagues at PSR. I've had the good fortune of linking all the way back to the 70s, and it's about time we do a little bit more work together again. So that said, I really am quite intrigued by the possibilities of being able to explore with you the ways of bringing forward the health impacts, the health benefits, if you will, of a smarter use of electricity resources, whether we're talking about energy efficiency, renewable energy, or clean energy technologies more broadly. So in that sense, we'll spend a few moments on the slides, but I'll show you a bit of the model as well. And as Barb has already suggested, the idea is to give you an introduction to the idea of so that we can explore the potential health benefits of the Clean Power Plan. This is a working assessment using, as Barb's already alluded, the EPA COBRA model. And again, COBRA stands for the Co-Benefits Risk Assessment Model. In that regard, to take a step back, yes, energy choices do matter. In this case, we're going to be exploring energy in the form of electricity from the various fossil fuels. Even before we start that, however, we have a little bit of a frozen screen here. Let me just get out of it and see what we can do to unjam this screen here. I'm not quite sure what's happening. Apologies, everyone. All right, there we go. So we're back at it again. So energy choices matter. Energy choices, together with the inefficient use of energy, that's key. All of that affects people's health, social, and economic well-being. At the same time, we find too often that policymakers consider only the cost of investments necessary to change the way we produce and consume energy, and that, needless to say, is only part of the story. Too often, then, the full array of benefits are overlooked. And here with COBRA, citizens, state and local policymakers can use this technique, this tool, to provide a reasonable estimate of the economic value of health improvements specifically that might be associated with energy efficiency, clean energy, renewable energy projects, and the like, so we can do a better job of telling the whole story about the nation's energy future. Citizen policymakers, as we'll see in a moment, can also use COBRA to create easy-to-read maps of the local impacts that emerge from the way we change the means of producing and consuming that energy. I'm a resource economist, as Barb's already said. I am not a health specialist. I was a medic in the Army, but a whole different field at these days. But I thought I'd take a moment to step back and show you the role of inefficient use of resources just in a preliminary way on the impact on the economy. And again, we seem to be having a frozen slide here. Let's see if we can change that. I'm not sure why this is happening, but these things seem to come with the territory. So we're looking at the well-being of the economy as might be limited by what I refer to as the anemic 14% energy efficiency of our economy. In other words, of all the energy we throw at the economic process, we only get about 14% of it that's useful work or useful in creating value-added gross domestic product and the like. And the critical element there is that inefficient use of resources, whether materials, water, but especially energy, is showing a downward trend on the robustness of the U.S. economy. That inefficiency creates an array of costs that constrains the well-being of the economy. This is by no means unique to the United States. In fact, I observe similar patterns within the developed and developing nations as well. Different numbers, but a very similar pattern. And from our standpoint here today, that same inefficiency, as well as the pollutants associated with the fuels we do burn to create electricity, that inefficiency also leads to unnecessary air pollution. So taking a step back to provide a bit more of a context, in 2015, fossil fuels accounted for about 65% of the electricity generated within the United States. This is down, the good news, from about 70% just 5 or 6 years ago. So we are moving already away from the use of fossil fuels. That's the good news. But no surprise, burning fossil fuel causes the emission of air pollutants, whether we're talking particulate matter, carbon monoxide, carbon dioxide, and nitrogen oxides. These are all pollutants that the COBRA model, the co-benefits risk assessment model, allows us to understand the impact. Electricity generation is also the largest source of carbon dioxide emissions, representing about 38% of total CO2 emissions in the U.S., contributing to long-term climate change problems. So the inefficient use, the nature of the fossil fuels that we burn are a major source of air pollution. Air pollution decreases the quality of air and, needless to say, increases respiratory cardiovascular illnesses. This includes things like asthma, chronic bronchitis, heart attacks, certainly premature death, and no surprise to many of you, children and elderly are among the most vulnerable. These impacts then, in turn, create harmful effects on our health. And I'm hearing a bit of feedback here. Yeah, so these health effects result in things like work loss days, people not able to work because they have some form of illness, either themselves or perhaps a family member. Certainly school days lost, medical bills, pain and suffering. All of these impose a significant set of social costs that we typically do not include when we evaluate future alternatives. And again, we're having a bit of a problem connecting here. So what is COBRA and how does it work? Using a screen from the EPA itself about the COBRA model, and we'll give you a pointer where you can take a look at this kind of information downloaded from the EPA website. COBRA is what we call a screening model. That is to say, it gives us a snapshot in time of impacts should we change the mix of fossil fuels, other resources necessary to generate electricity. So it converts emission reductions. We might be talking emissions in terms of particulate matter, PM2.5, sulfur, nitrogen oxides, ammonia, volatile organic compounds. Those emissions, as they may change the air quality, and then as that in turn affects the number of illnesses and deaths that might be avoided, and their economic value of avoiding those premature deaths over time. So COBRA quantifies the changes in air quality, reduction in emissions of various sorts. It then calculates the change in health outcomes, reduced work days that might be lost, reduced mortality, premature mortalities. And then it provides, based on a very strong set of literature, estimates of the monetary value of improving these health outcomes. So the output in COBRA is a set of tables and maps of showing how the illnesses and deaths avoided and how that might impact the overall economic return to the well-being of U.S. society and the economy at large. So exploring health impacts from implementation of the Clean Power Plan specifically. So again, we typically say, here's what we got to invest to provide more energy efficiency. Here's what we got to invest to provide more renewable resources as part of our generation mix. And in the case of the Clean Power Plan, what we need to do to reduce carbon dioxide emissions from the electricity sector. But with that plan in place, we can also then add to it the health benefits that typically is not understood or often reviewed. So I've got to switch slides again here. Apologies. On August 3rd, as many of you know, President Obama and the EPA announced the Clean Power Plan, or what we call here the CPP. I think you'll agree that this is historic and a very important step in reducing overall carbon pollution from power plants. When fully in place, the carbon plan, the Clean Power Plan, in 2030, we can expect a carbon reduction of about 870 million tons from the power sector. In other words, 32% below 2005 levels, a very important step in the overall reductions we ultimately need to achieve. That 870 million tons, we thought about it differently, would be equal to the annual emissions from more than 166 million cars, or 70% of the nation's passenger vehicles. So a fairly significant reduction indeed, an important down payment in this regard. In effect, using an array of efficiencies, clean technologies, renewable technologies, the Clean Power Plan will reduce average conventional generation by 30% in 2030. There is a difference between how we generate electricity in 2005, how we might increase electricity use by 2030. So the overall reduction of a 30% if we follow the Clean Power Plan from 2030 levels. What we want to do is look to see what the health benefits of the Clean Power Plan might mean. According to the EPA, the Clean Power Plan has public health and climate benefits worth an estimated $34 to $54 billion a year in the year 2030. This far outweighs the suggested cost of $8 billion in that year. And we can use COBRA to really help us tell that story, and hence now taking a moment of a dive into this. So the case study I'm going to use COBRA is to explore the impacts of a 30% reduction in overall conventional U.S. electricity generation by 2030. I could focus just on coal. I could focus on some mix of coal and natural gas. But to simplify matters, I've simply said, all right, if the Clean Power Plan is in place across the U.S., a 30% reduction in conventional generation, whether brought about by half efficiency and half renewables or some other mix, In other words, we're reducing pollutants and what impact that might have. And I still seem to be having trouble with the slides, so let me again kick it back over and see if we can pull this up. So there are about a dozen or more metrics associated with COBRA, and if we tell COBRA we want to reduce emissions across the United States by 30% on average, we might see then total health impacts from COBRA would say that we have a $25 to $56 billion per year benefit. In other words, we're avoiding health costs in that range from the reduction of carbon emissions, the co-benefits, hence the name of the model, $25 to $56 billion per year. Very close to the official EPA estimate, so we know we're more or less in the same alignment with what we might otherwise expect. Again, this COBRA is a screening tool, means it gives you a snapshot as opposed to a rigorous year-by-year estimate, but we can see already that we're in sync with what the EPA has suggested might benefit from the Clean Power Plan. We'll explore a little bit more of these impacts in the form of adult mortality. We might expect to avoid about 2,900 to 6,600 premature deaths per year. In other words, reduced exposure to these pollutants may allow a longer-lived population. Upper respiratory symptoms might be down 77,000 cases per year. We might avoid the loss of work days to the tune of 361,000 lost work days per year, no longer necessary because employees are either healthy or they no longer have to take care of their family. And we may see benefit in the form of minor restricted activity days, people who are not especially ill but have to stay indoors or not able to conduct normal activity as they might normally expect to. That might be 2.2 million person days per year. These are national benefits. The good news is that we can explore these impacts at the state and county levels, and we see some interesting results emerging there. One set of results I took a look at, if only my utility, Tucson Electric Power, were to reduce its overall emissions in my two counties. You see the part of the U.S. here, the southwestern part of the U.S. My county, Pima County, you see the little red dot there is where I am in Tucson. And Cochise County to their immediate right. Those are the two counties that Tucson Electric Power primarily serves. And if those two counties reduce emissions by 30% because of carbon benefits, we begin to see other impacts emerge in the form of health benefits. What I've done is I've created a gradient according to costs depending on the magnitude. So the very light blue counties, you see all these are counties on the map, anywhere from $600,000 to $100,000 of avoided impacts because of actions we took in the Tucson Electric Power region. Or from $100,000 to $500,000, slightly darker blue, or from $500,000 benefits to $1 million benefits, or in the very dark blue, $1 million to $5 million of avoided benefits. Some interesting things you see already. Yes, as you might expect, there are reduced impacts in Pima County, Cochise County, because we are no longer using as much generation of coal as we might otherwise depend on. But these pollutants are airborne. They travel, and they affect other counties outside our immediate service territory. So there is an ethical issue here. Should we allow our emissions to continue just for our convenience when they clearly have an impact on other counties across the country? You'll notice above Tucson to the left is Maricopa County, where Phoenix is, that dark blue. So Maricopa County benefits by actions we take in Pima County and Cochise County. Or you see a number of counties in California that have reduced impacts of significant amounts. So we're not only able to map out these county by county levels, but we also have the benefit of understanding that the things we do in our own hometown clearly have an impact elsewhere in the country, and that ethical issue is an important thing that might be brought forward by the use of the COBRA model. If you're going to excuse me, I'm going to take a minute to dip out of the slides and take you over to look at the COBRA model itself very quickly so you can get a sense of what we're looking at. Here is the opening screen of the COBRA model, and what we really are looking at is the assumption that if we reduce emissions by 2017 emissions by some amount to comply with the Clean Power Plan, for example. I've suggested in the case of Pima County and Cochise County, the Tucson Electric Power, 30% reduction of coal, how that might look impacting the year 2017 profile of electricity generation. In other words, as a screening tool, it cannot evaluate year after year after year, but it can say if by 2030 you reduce total coal consumption for electricity generation by 30%, here's how it would look in the year 2017 as those reduced emissions affect the health quality of people throughout the United States, in the local counties, in adjacent counties, and across. We can look at this at a nationwide total. We can look at it for individual states. We can decide to click on one state or another, as I've done in the case of Arizona. We can explore individual counties and the like. I have already taken a look at Tucson Electric Power, again, Pima County, Cochise County here in Arizona, and we can get a look at what this looks like from the standpoint of emission reductions at a number of different levels. It's taking a moment for the screen to make that transition. And the first table that we're going to see is beginning all the way up in Alabama. We can look at the impacts across the country, county by county by county. You'll see at the bottom of the screen as my arrow is pointing the total cumulative health benefits taking action in Pima County and Cochise County has a total impact of $27 million, excuse me, across the U.S. with different amounts for different counties. That's on the low end. On the high end, it's as high as $62 million from actions we take only in our county, but as those pollutants migrate across the U.S. in various ways. We can see that there is about 3 avoided deaths from Tucson and Pima County, Cochise County taking action to maybe as many as 7.3 avoided deaths. Now we can look at this all states, or we can then quickly look and see what the impacts would be in Arizona alone. And if you give me just a second to make that transition. In Arizona alone, you can see all the counties in Arizona from Apache, Cochise, which we've already referenced, Gila, on down to Pima County. My county is Pima County. And in Pima County, about $1.8 million of avoided health care costs because of the actions we take to reduce coal in that county, to a high of about $4 million. But across Arizona as a whole, it grows to about $6.7 million on the low end to a high of $15.2 million. Now, as I said, these are health impacts over time out through the year 2030 in this case, but we're looking at a snapshot in time in the year 2017, so COBRA allows us to say what would be the effect if all of this were to happen in that year of 2017. And avoided deaths mean we've got lost income over the lifetime of that worker or that person, income benefits, as we might discount it back to the year 2017, which is how you get some of these costs ranging from $6.7 million to $15.2 million. So that gives you an idea of how we can use COBRA at any number of different levels. We can look at one county only. We can see what reductions in a state would do. We can see what reductions in the state might do for other counties across the U.S. We can explore different levels of penetration of different technologies and the like. And we can also see this in a mapping exercise. You already got a hint of that. Here's the snapshot of the map for the United States. Interestingly, every county appears to be, to some extent, whether just $6 or more, affected because of the migratory nature, the transport of these pollutants, and given the population, the overall health of populations, clearly impact across the way. You can see that we can choose other metrics here. I'm going to give you a list here. So lost work days, asthma exacerbations, excuse me. We can have total health effects high. I'm now showing low, but a number of other impacts as well. Lower respiratory symptoms. We can have asthma, emergency room visits, minimum restricted activity days, and the like. So we can explore these in a mapping way to show impacts across the dimensions as a result of a smarter use of resources more productively with cleaner technologies like renewable energy technologies and the like. So returning then back to the slides to give you a sense of COBRA in a quick order, let me give you some final thoughts. As Barb has already suggested, for many of us, accessing COBRA may be a little bit beyond our skill set, but for someone who has a reasonable experience in using web-based analytical tools, who may have a working familiarity with the Clean Power Plan itself, understanding the percentages that may be associated with use of electricity or use of coal in a state or a utility service territory, I'm suggesting downloading and running the COBRA model from the EPA website to produce those first results, what I call toy results, or just getting used to playing with to see what the numbers might look like and how well you might be running the model. That might take about 4 to 6 hours of initial effort. Obviously, if you want to tell the story, you have to read the manual a little bit to get a sense of what each of these health impacts might really mean and how they stack up against other activities and other benefits and so on. At the same time, as Barb said, I'm president of an academic organization, the Association for Environmental Studies and Sciences, and I can tell you there are any number of college and university students who might be willing to volunteer, who might be willing to intern with your organization or some collaborative group to help give you the ability to learn about COBRA and the Clean Power Plan, to help PSR itself or others tell this very important health impact story. In short, the effective use of EPA's COBRA model can help bring it home to people in ways that they've not heard about before, in visual ways that really underscore the importance of the Clean Power Plan, not only with regard to climate, but the immediate health benefits. So how can you learn more? I've provided from the EPA slide deck, again, 3 things. I've provided a link so you can see where the COBRA model resides and how you might download it. We'll take a look at that in a moment. But I've also provided a link to the EPA Clean Power Plan fact sheet so you can quickly read about some of the implications, some of the things you've heard me talk about here. A former colleague of mine, Denise Mulholland, with the EPA state and local climate energy programs in Washington, D.C. I worked with her when I was at the EPA 1996 to 2006. She's still there, still very active and very helpful in sorting through and guiding people in the use of the COBRA model. To step out of the slide deck again here, let me go to the website. I can show you the screen. I've given you the link in the slide deck where you can go to, but you can see quickly the EPA screen for the co-benefits risk assessment model. And you can see that there are a number of things you can download. A review of the health and economic benefits of policies that affect air pollution, an explanation of what is COBRA, why use COBRA, who might use COBRA, how does it work, how to run scenarios, analyses that have in the past used COBRA, as I've done with a number of my clients, and then you can actually learn how to download COBRA to your own system or to your own office organizational system so you can have an intern or someone who might be able to step forward and learn how to work with it. So that's COBRA itself. And then if you want to learn more about the overview of the Clean Power Plan and the merging of the two, as you can see, you can download this particular fact sheet and just paging down here why we need the Clean Power Plan, the benefits of implementing the Clean Power Plan, and you already heard me allude to a number of health benefits, net benefits of $26 to $45 billion, very consistent with what I showed you in my little working exercise, and how the plan works, and so forth. So with that in mind, we go back to the last slide, which is for those who want to have further information about COBRA, about this kind of assessment tool, and want to contact me directly. Here are my coordinates and my affiliations for purposes of understanding what I might bring to the table. That said, Barb, I'm happy to perhaps spend a bit of time answering questions and sorting through what things people might have to say.
Well, thank you, Skip. Thanks both for your willingness to answer questions, but more importantly for this introduction to this really somewhat dazzling, if perhaps slightly overwhelming tool, which is COBRA. Again, for everybody who's on the call, we'll send out tomorrow a link to this presentation, which we'll have posted online, so you'll be able to both Be sure you know how to be in touch with Skip if you'd like to follow up with him, but also you'll have the links to the EPA website's COBRA pages, and you'll be able to both look at their how-to information and maybe dip into the program itself. We do have a couple of questions that are stacking up, and I think we may have some more coming. So let me start with the first questioner, which was Linda Helland. Linda Helland had a question, and Julia, if you can unmute Linda Helland, we'll go ahead with Linda's question. Linda, go ahead. Let's see if you're unmuted yet. Well, we don't seem to have found Linda yet. So let me just read her question, and then Skip, you can answer it. It says, for the county-specific estimates of cost reductions from the health benefits or reduction of coal-generated electricity, are those estimates on a per-year basis?
Yes, two things I might say about that. First of all, these are estimates based on pollutants in the county, as opposed necessarily electricity generation. And for counties that import electricity, they may have a different profile from those that actually produce electricity in that county. So we start with emissions, and what we're looking at is in the year 2017, what COBRA does, it says, here's how county by county the current profile of electricity production consumption might look in the year 2017. And even though we're looking at the Clean Power Plan with results by the year 2030, we're saying if those impacts in 2030 were to occur in the year 2017, those would be annual impacts in that county, in that state, or for the U.S. as a whole. So we really, if you wanted to do a step-up job, if you want to say, well, here, taking 2017 in consideration, here's what we think we might achieve in the year 2020, then run COBRA to get some impact based on that single year. Then you might run 2025, what you think the reductions might look like in your region, your service territory, as that would affect the 2017 totals, or going all the way out to 2030, as I've done, and see what that might look like from a 2017 perspective. So it's not a scenario full-blown modeling, but it's a screening tool to give you an idea of impacts in the year 2017 as if they were to occur in that year, depending on what year you might want to actually explore.
Okay, thank you, Skip. We have another questioner. I'm going to read your name, and apologies in advance if I mispronounce it. It's Vijay. The last name is Limaye, or Limaye. Julia, if you could unmute Vijay. Vijay, go ahead with your question, please.
Hi, Skip, can you hear me?
Yeah, sound like aboard an airplane, but I can hear you.
That's not me. But I was wondering, I've done a lot of work with EPA's NMAP model, and I was curious how COBRA sort of compares and contrasts with that, and I guess just in terms of the inputs, and you mentioned kind of some other scenarios that could be run through COBRA, how that would differ, and I guess in general how the air quality information is, derived in COBRA. Thanks.
Yeah, very good question. EPA, the Research Triangle. Can we mute that? Oh, good, thank you. EPA has quite a number of analytical tools, BenMap being one, and the folks down Research Triangle Park in North Carolina have an extensive capability to model to a very fine level of detail. And what's been done really is to try and aggregate these again to a single year with a profile of emissions county by county level. The source of the emissions, in this case electricity generation, whether it's coal, whether it's natural gas. Interestingly, we're focusing on a Clean Power Plan, but COBRA also has a very rich inventory of other energy uses, whether we're talking transportation fuels, whether we're talking industrial gases, what have you. So it goes well beyond the use of natural gas itself and as combustion in homes or in industry as a heating process, what have you. COBRA has the ability to look at well beyond just electricity generation, so just to bring that out. But essentially, again, it lines up very nicely. COBRA lines up very nicely with the other EPA analytical tools, but it's a snapshot. It's looking at some reduction in emissions brought about by the Clean Power Plan or by energy efficiency policies in individual states, or a state may have a renewable portfolio standard that it wants to implement, and there are some steps you would take to say, well, if we implement that renewable portfolio standard, here's what it would mean for emissions. So you go into COBRA and you say, we want to reduce PM 2.5 by 30%. We want to reduce SO2 by 30%, or whatever the numbers are in that county, in that state, or across the U.S. as a whole. And it gives you a comparison for the year 2017 only, regardless of when you achieve those impacts. So it's not quite an accurate reading, but it is a very developed and well-researched analytical tool to give you a sense of the magnitude, so we can do a better job of telling the other benefits of things like the Clean Power Plan or renewable portfolio standards. Does that help, VJ?
VJ is probably muted now, so we'll call on our next questioner, who is Alan Lockwood. Julia, if you could unmute Alan Lockwood.
Hi, Skip. Thanks very much for donating your time. I poked around on the COBRA website a bit and encountered a choice between a 3 or a 7% discount rate. Could you explain what those are, and which do you think is a better choice for us if we want to try to do this ourselves?
Yeah, as an economist, that's a very familiar metric. Can we mute that? So the question is, what the heck do we mean by a 3% discount rate or a 7% discount rate? What we're really doing, and it's a real good question, is saying in the year 2030, we may have some avoided mortalities, and that means we've got people who are no longer having the income benefits, whether they're working, whether they're having Social Security benefits, something like that. And that's in the year 2030, and we're really looking at the impacts in the year 2035. So COBRA really tries to say, all right, the value of the benefits in 2030 are different than they might be today. So what we really want to do is get a sense of how those benefits might otherwise look using a 3% per year discount rate. So 3% a year, let me just do a quick calculation, would mean there's about a 60% reduction, perhaps 20 years out, of the benefits as it might be put into today's dollars, something like that. So 3%, really whether you think there is a value of 3% discounting future benefits from the year 2030 to 2017, or whether you think it's a 7% discount rate of valuing future benefits to today's or in the year 2017. EPA recommends you run both the 3% and 7%. You'll get a slightly different set of monetary impacts. You'll get the same health impacts in the sense of avoided mortalities or lost work days, but the economic benefits associated will be changed according to whether we discount future benefits 3% a year or 7% a year. My own preference is I tend to prefer the lower discount rate because the human life simply cannot be discounted. Does that answer the question?
We'll move on to our next question. Our next questioner is Skip, your fellow Arizonan, Barbara Warren. Julia, if you could unmute Barbara Warren.
Hi, can you hear me?
Yes, yes. Hello, Barb.
Okay, hi. Okay. I was wondering, given our current debacle in Congress with the lawsuits and people trying to undo the CPP process at all, how can we describe the health losses of not implementing the CPP? And is this just simply lost opportunity, just reversing the numbers we're using, or are these costs compounded in some way, or I mean, how would that work?
Yeah, I've thought about that. That's a darn good question. Why didn't somebody tell me we had a logjam in Congress? That's news to me. I've done this thought experiment. If 30% reduction gets you, say, 20 to 30 billion dollars in benefits just from electricity use only, then we might say that 30% could be expanded by a factor of 3. So a $20 billion benefit today by reducing 30% means there may be a 60, 70 to $100 billion impact no matter what we do. So we might be able to tell the story that, hey, if we reduce emissions, we're really helping a number of people in the quality of their life, or helping reduce the number of premature mortality. And we can provide some working estimate of the size of that benefit. I mean, PSR, among others, the American Lung Association, many researchers around the academic community have provided estimates of these. In the manual for the COBRA model, there is a very rich literature with a very rigorous description of the methodologies used. So we can simply tell our congressional delegation or our state legislatures or the Arizona Corporation Commission, given COBRA, here's what we might imagine now is happening with regard to premature mortality or increased asthma attacks or upper respiratory illnesses. And taking simple steps like reducing carbon dioxide 30% gives us back this many people's lives. So it really depends on working together with marketing people, with designing maybe smart infographics to help illustrate the story. COBRA gives us a rich data set that we can use to round out the information that typically is ignored or overlooked by most policymakers.
Thank you.
I hope that helps. It's a complicated subject, needs a lot of discussion and a lot of talking through, that's for sure.
Thank you. Our next questioner is Susan Katz. Julia, could you unmute Susan Katz?
Yeah, I'm basically thinking that this is all based on our current monitoring data on the local level. And I'm wondering if it's really good enough to, the information that you get out is only as good as the information that you put in. And I don't think that EPA is getting accurate data, enough accurate data out of my state anyway, with a very inactive DEQ. So the question is that a limitation?
It's a starting point. First of all, most policymakers, most business leaders have never seen information like this. So just rounding out the story, really helping figure out ways to talk about the full set of benefits, health impacts being a critical part of that, is a step forward. Yes, one might say better data could be collected, more sites, more routinely, better quality of the data, the storing, the recording of the data could be all improved. Even without going down that path right away, we have a heck of a story we can tell. The information is really significant. The impacts are palpable. They're very real. They have real economic impacts. So while we can worry about and fret about needing to improve the quality and the timing of the data, it still gives us a very important beachhead to begin telling that story. It's a story that badly needs to be told.
I agree, yes.
So I would say to the extent that the data is improved, the number of sites are expanded, the timing of it is made a little bit more rigorous. Yes, that helps tell the story, but boy, do we have a heck of a starting point right now. So we should do everything we can to mine this data set. Like I said, in Pima County, for example, whatever actions we take in Tucson has real effects in California, has real effects in Maricopa or Phoenix. And I think people are made more aware that what I do here in my place of living has an impact on what you do in your place of living, boy, we better get together. I think that's an important issue, the ethical considerations together with the monetary value.
Thank you. Our next question is from Andrew Jameson. Julia, could you go ahead and unmute Andy Jameson, please?
Hi, I'm interested. I'm going to be testifying at a Clean Power Plan hearing on Wednesday, and I get about 3 minutes. And one thing I want to say is, roughly, we owe yay amount of our health problems to coal overall. I want to say that in a quick way, not just focus so much on the effects of the Clean Power Plan, although that's important. That's the second line. But the first line, I think I want to say something in general about where coal pollution and fossil fuel pollution sort of rank among the other healthcare problems that we face.
In terms of the monetary impacts, is that what you're asking?
No, I'm actually more interested in what might be called the burden of disease, how much life is lost all in all, how much premature death is there all in all attributable to coal-related pollution.
Well, good question. I can tell you, is my screen still live right now?
I can see a screen.
You see a spreadsheet?
Yes, a spreadsheet.
All right, so what I have now is the actual spreadsheet I've downloaded from the COBRA model. This is the reduction of a 30% lower carbon emissions as it might be made manifest in the form of lower pollutants, whether PM2.5 or sulfur oxides, dioxides, and so on. So you can see here the low is the $25 billion avoided at the national level, and then I've provided specific statewide estimates. You can see for Arizona, I've said, well, if we take this action as an average across the United States, 25 billion on the low end nationally, Arizona's share would be about 69 million, 56 billion, that's in the slide deck I gave you, at the high end. Arizona is about 157 million. The mortality in Arizona, or each of the states that I've added up, Arizona has an avoided mortality of 8 to 18 people. We've got up here nationally 2,900 to 6,600 people. And then you can see I've aggregated all of the states so you can see state totals. So you know, I can make this spreadsheet available and you can figure out how to manipulate it. I don't mean it in a negative way, of course, but how to use the data to better tell your story if you think that would be helpful to you.
I think it would be helpful.
Barbara, I will be happy to email this workbook, and if I can be of help in walking you through it, happy to do so. I can at least give you the workbook I've created.
Good, thanks for that offer. If you'll email that to me, I can make sure it gets to Andy Jameson, or if it's okay with you, I'll just send it to everybody who's on the call.
All I promise is somebody who uses it offers to buy me a beer at some point in time.
I'll fill in for you on that if you like.
Fair enough. I appreciate that.
We have a question from Michael Geschwind. Julie, if you could unmute Michael Geschwind.
Oh, hi, can you hear me?
Yes.
Oh, hi. Yeah, I guess I was just surprised by the pervasive effects of the single county, and I'm just playing devil's advocate, and if I just seeing that, it was almost a little suspicious that you saw uniformity in the effects from that one county, and I would have expected there to be an effect that would be preferential for certain regions based on wind flow, but to see that Seattle was as equally affected as, you know, some other area. Actually, when you pulled up even the bigger map of the United States.
Yeah.
And then also, like in the spreadsheet you were just showing, you looked. There was a cost effect in Connecticut that was the same as California, and you know, which was quite surprising. I wouldn't have expected expected that. So I guess I'm wondering what goes into this model. Why would everything be so equally affected? It makes me a little bit suspicious about what's going on with the modeling.
Yeah, no, the good question. The good news is that what seems to be equal is not. Notice that the counties across the United States are all lightly blue coded, but that's a range from $6 per county to $100,000 per county of impact. So that's quite a dispersion range. But what goes into the model is that EPA has a data set of emissions county by county, again looking at the year 2017, compared to 2005, their last inventory like this, for example, huge reduction in sulfur dioxide emissions. So we're already having some benefits. Instead of, I think, 10 million tons, we're down to under 2 million tons right now of sulfur dioxide emissions already. So it's the range of estimates in any county, and it's an air dispersion model with exposure to populations across, and it really depends on the function of winds and other influences that drive these impacts. But we're talking really probably in Connecticut, as you suggested, that may be on the order of $6, whereas closer to California may be $100,000, but they look the same color. So there is that range. But you could also then go, as I've suggested, to the individual, and let me just go up here. I've got all 3,000 counties up here in the spreadsheet tool here, and you can see quite a range. I'm looking at now adult mortality low, ranging from 3 in Baldwin County in Alabama, all the way down to 0.05 in Wyoming. So there is quite a range, and I just happen to arbitrarily pick, sort of top and bottom as among the almost 3,000 premature mortalities that might be avoided from actions. And these are actions across the U.S. too, so it really depends on what gradation you're telling the map to look at. But there is an enormous variety from county to county, which should bring you a lot more confidence. These are very tightly constricted ranges, but a good deal of variation among them. Does that help?
Thank you.
You bet. And again, you'll see this if you ask Barb for the workbook I will forward.
Okay, we have a question from Mike Menzel. Julia, if you could unmute Mike Menzel. Mike, you can't unmute yourself, but Julie will do it for you.
Hello.
Hello, Mike.
Hi. Yes. My question is this model strictly based on CO2, the benefits of reducing CO2, or is also particulate matter and nitrous oxides also included in this model as part of the benefits?
Yeah, good question. It's helpful to tease this out a bit more. The CO2 is simply a target from the Clean Power Plan, trying to get a reduction by 2030 of some magnitude over 2005 emissions from the electric generating sector. But COBRA does not recognize CO2 as a health pollutant. Rather, it recognizes PM2.5, it recognizes sulfur dioxide, volatile organic compounds. So to generate what if a reduction in carbon, we have to provide the model with insights on how that affects the other emissions, basically. So the model is strictly the health benefits of avoided critical air pollutants, and we're getting those reductions because of the Clean Power Plan. So it does not include carbon dioxide emissions. Does that help explain?
Yes, that helps clarify it. Thank you.
You bet. Thanks for the question. It's important clarification.
Thank you. I don't see any more questions showing up on our board, and we have a few more minutes left. So I wondered, Skip, if I could ask you a question and maybe ask you to put in a little plug for your upcoming conference. You talked about the fact that we might, those of us in organizations and chapters that are interested in pursuing this COBRA model, but are not perhaps fully equipped to do so on our own, that we might be able to get help from economists or maybe from certain kinds of environmental scientists in our communities, and that we might think about looking for graduate students who'd be interested in pursuing internships with us to help us unpack some of the value in the COBRA model. So I wonder if you talk about two things. One, just very simply, what would you say to a potential intern that you were looking for so we could get the right kind of conversation started? And then secondly, your Association of Environmental Studies and Sciences, which is having its conference in Washington, D.C. in June, is very interested in interdisciplinary collaborations, and I wonder if you could talk about any possibilities you see for interdisciplinary collaborations between environmental scientists and health professionals, perhaps inspired by your talk today.
No, very good question, and if I might just reverse the order and begin with ACE, the Association for Environmental Studies and Sciences. Yes, this is a largely graduate level group of faculty, senior faculty, assistant professors as well, primarily with PhD graduate students, but also a number of master's level students and even a few undergraduate students. And we're gathering in Washington, D.C., as you said, at American University, June 8th through the 11th. You can go to ACE online, AESS online.org to find out more about us. But that is indeed a rich opportunity to connect, to see about providing support, either for faculty and or for students. And I can tell a couple of stories. I've brought students into my organization from the University of Arizona, elsewhere, Johns Hopkins University there in Baltimore and D.C. area, elsewhere, who, because of the experience, were able to help build their network and land jobs or make other connections they would not have otherwise made. So an undergraduate, many people who are very good with spreadsheet skills, undergraduate would be able to run this model for, say, a PSR chapter or some other organization. It might take at least a master's, more likely a PhD student, to really work their way through the algorithms and through the data to understand what's really going on. So in part it depends on whether, say, the local chapter simply wants somebody to help shape some kind of a presentation, in which case a undergraduate student who would benefit hugely by having an internship with, some good comments from their mentor or from the organization director or staff supervisor, what have you, to experience it. Some of this could even end up in PhD dissertation topics. I could imagine a number of different topics. Some of the questions posed here today, how valid is looking at the year 2030 as it might be cast with 2017 results? That could be a whole set of research topics that a student could explore, dig into, maybe even helping refine some of these things in the future. Or, as the one comment was, you get suspicious when all the colors look the same. Well, I've got a guy who's a good GIS student who could tease out and provide a better mapping, a richer mapping, so we see the diversity of impacts that really does occur. We're not restricted to 4 categories. As I put up there, we might have as many as 10, so you can see the huge variation. I would suspect you'd see more of the darker colors to the west with a lighter range of colors to the east if we had a better mapping brought about by that student expertise. So I think there is a rich opportunity, and I'm coming across students, faculty, programs. Among our group is the group called the Council for Environmental Deans and Directors, whereas I work with the faculty and the graduate students. We've got the directors of university departmental programs or university deans, whether the School of Natural Resources or Environmental Sciences, what have you, who are always looking for outlets. And I think there's a rich opportunity to make these connections, these linkages. So I really do encourage that.
Well, thank you for that, Skip, and thank you for this wonderful introduction to the COBRA model. I think from the number and the richness of the questions, you can see there's a lot of interest in this. We're about at our time, so thank you everybody for joining our webinar today. As I mentioned, we will be sending out the link to the webinar recording, and I will send out Skip's workbook And thank you very much. That brings us to the end of our webinar.
Thank you so very much.